Seizure is a very complex disease. Many of them, they are not actually the disease per se, but just the changes in the brain electrical stimulation, which gets apparently conducted and excites the other cells. Now, if you look at the cause, there are several causes of it. There are some structural damage which can happen to the brain and can manifest as an epilepsy or fit. The fits problem is there since ages. There are many reputed eminent people like Napoleon, George Bernard Shaw, Julius Caesar, Leonardo da Vinci, and you can name many others, those who had this problem. So it's not true to say that if somebody has got the epilepsy cannot achieve the highest pillars of the life. Epilepsy can be treatable, can be treated in various ways. Drugs are the most important ones. However, surgery can also be considered in certain cases. Epileptics, they respond, almost 70% of them, they can respond to the therapy, the medical therapy. There are several drugs, only neurologists know it well how to adjust the doses and treat it accordingly. So I would request all the epileptic people to go to the concerned doctor or specialists to consider for the best management. The drugs have their own side effects, so judicious use of the drugs and regular monitoring is important. Regarding the use of the drugs and the side effects, one should be careful that if the drugs are inadvertently stopped or it is not taken in a proper dose, the side effects as well as the fallacies of not taking medicine both have to be taken into consideration. The epileptics should not do certain things, like they should not stop the medicine on their own. It should not be abruptly stopped. No irregularities in their sleep cycle. They should go early to bed. They can at best wake up early and then take up their duties and regularly. They should not remain starved for long. Stress and anxiety does aggravate at times, so one should be careful about how to manage his own personal life and the mental peace. They should avoid agony, anger, frustration, because that can aggravate seizure. Coming on to the watching TV, it's a commonly the parents come and ask that my child is using computer too much and then TV. There are certain photosensitive epilepsies. That category of people, that category of disease gets manifested when they are exposed to all this type of exposures. There are certain conditions where the brain can be organically damaged or structurally they are having some damage. There can be neuroinfections which can cause seizure. There can be tumors, there can be structural genetic modifications, there can be congenital anomalies which can present a seizure. Stroke can manifest as a seizure, and there are many other conditions. One needs to be evaluated properly for the cause of seizure, and treatment should be accompanied with the various other investigation reports and regular monitoring and follow-up. Epileptics are not different from any common man. They just need a proper treatment. There are lots of social stigma and taboos attached to epilepsy in various ways, and particularly in countries like India and Southeast Asian countries. Even it's not free from European countries too. So the society needs to be evaluated, educated about it. They should be said that okay, this is just a disease like any other thing, and then that should be considered as one amongst them. The teachers, the parents, they need to be counseled properly so far as the pediatric epilepsies are concerned, because if the child is unusually pampered or being restricted for every damn activity, they do develop some changes in their personality, and that should be avoided. The teachers in the school should encourage such children to participate in all the activities, albeit they should take care of them. They should restrict them where they are not going to endanger themselves. There's another issue comes up is about the driving and epilepsy. In several countries there are laws to say that yes, certain period of time they cannot drive until they are seizure free, and many medical boards have to certify that yes, they need to have the license. But in India there is at present there is no such law. However, somebody, if they are seizure free for a pretty long period, which is variable at various other conditions, like if a patient is just having some common type of disorders where they respond very well to the drugs, They can at best go for driving after years remaining seizure free, but there is no definitive law for it. However, epileptics should understand if they drive, they can harm others as well as they can risk their life too. So, judicious use of this mental strength of not driving or driving should be taken into consideration. Good amount of psychological counseling is required, and I wish epileptics should be considered as normal human beings and treated appropriately.